As the United States hits 6 million coronavirus cases and we enter the 6th month of the pandemic, we are learning more about those who have died from this virus.
National correspondent Erlanger breaks down the key data from a new report from the CDC.
A new detailed report from the Centers for Disease Control and Prevention explains the conditions of coronavirus patients before they died. The report shows more than 90% of people who died from the virus had a comorbidity. Syracuse University's Dr. Brittany Kamush explains.
So comorbidity means when more than one disease condition exists in the same person at the same time. Morbidity is a disease condition as opposed to mortality, which is death.
The CDC listing some of the most common comorbidities with the coronavirus to be the flu, high blood pressure, and diabetes. And according to Dr. Anthony Fauci, this shouldn't change how people view just how deadly the coronavirus can be.
That does not mean that someone who has hypertension or diabetes who dies of COVID didn't die of COVID-19. They did.
According to the CDC, close to 10,000 people who died from the virus did not have a comorbidity.
So the numbers that you've been hearing, the 180,000 plus deaths, are real deaths from COVID-19.
Though some have grown tired or skeptical of these numbers, Dr. Deborah Birx encourages Americans to stay smart.
Not only is the virus real, the consequences of the virus is real, the hospitalizations that we still have every week is real, the number of Americans that we have lost to this virus are real.
In Washington, I'm Erlanger reporting.
Some physicians in our area are calling this new data from the CDC misleading. Dr. Jay Sizemore, Erlanger's medical director of infection prevention, says that this shouldn't change the way we look at COVID-related deaths. He says this data just reaffirms that people who are sicker to begin with are more likely to have bad outcomes from COVID-19. According to the latest numbers, the U.S. makes up for more than 21% of the world's COVID-related deaths. Dr. Sizemore says that's why he cautions against the perspective that this new data means COVID-19 is any less serious.
There's a 17 or 18% excess deaths over what you would expect to see based on the proportion of the world's population that reside in the U.S.
Dr. Sizemore says common underlying conditions like kidney disease or diabetes are telling that a person is at high risk of virus-related complications.